participate in a run and I had a back fall and I just torn my ligament totally.
She had an injury to her knee, which could be almost, you could define as career-threatening, or something that would have kept her away from sports. She had an ACL ligament injury to her knee, and also had torn her lateral meniscus pretty badly. She had a complete tear of the ACL and needed a reconstruction of the ligament.
I had to do an MRI and get two opinions about the situation, and so that's when the second time I went to Health City.
When she came to me, she was in considerable pain with also a problem called instability in the knee, which happens due to ACL injuries, where you lose stability in the knee and the knee does a movement which is not natural. So this is a knee joint, and when you take the patella outside, you have the ACL. So this ligament here is the ACL ligament. It's a really tiny, small ligament, and but it's a very important one because it prevents your knee from doing this movement. It prevents your knee from going forwards or pivoting. So if you have a tear of that ligament, you develop instability where your knee tends to buckle or almost tries to dislocate by pivoting outside. She was in a brace with a lot of pain, and whenever she tried to walk, she was buckling because of the instability in her knee. She had a tear of the meniscus. This is the meniscus tissue. So she had a tear of the lateral meniscus in her knee as well. And so a piece of it was stuck between her joint, and we needed to trim it and smoothen it out.
There was no choice because my ligament was almost 100% torn, so I needed to get repaired, especially because I want to go back training and do things I was doing before, and without the surgery I wouldn't be able to do it.
It's one of the minimally invasive surgeries that helps the patient not only recover fully but also get back to a previous level of activity, as in getting back to active sports, even contact sports like football and soccer and basketball and sports like that. Just any surgery will not do for anybody who wants to go back to sports at a competitive level, as in that what maybe something like CrossFit requires, or a high level of professional stability that is required in the knee.
Yeah, the staff at Health City, they were great with me, so I felt very comfortable there, and I highly recommend anyone to go there. Without the surgery, I wouldn't be able to work out and do the things I do today, and I thank you, Health City, for that.
She's doing the half marathon this year, and I wish her all the best. I'm really pleased and glad that she has been able to get back to the level of activity that she has.